Good afternoon, everybody, and welcome to the webinar. Today, we are kicking off a brand new series, and in honor of Mental Health Awareness Month, which is in May, we have put together a fabulous webinar series on mental health and cardiovascular disease. And today is our first webinar, and we are going to look at the psychological connections and changes after a heart event and the body's response to stress and anxiety, which is a hugely important topic for us to cover. Before we begin, I just want to give a couple of little updates to make your webinar a little more enjoyable. All attendees are in listen-only mode. I always laugh when I read this, but if you can't hear, hopefully you can read the slide. Check the audio button on your personal computer to ensure the sound is on. That's typically the issue that we see. Please type your questions into the Q&A box at any time during the presentation. I will read the questions out after the presentation, but you can put them in the box at any time when the question comes to you. That way you don't forget it. And then a PDF version of the slides, as well as a recording, will be available on the Mended Hearts website. And then we have handouts, and they're available in the handout section, which is actually the chat, I think. So the same thing as the chat. But Leslie will be putting those on there. So Mended Hearts, if you're new to us, mission is to inspire hope and improve the quality of life of heart patients and their families through ongoing peer-to-peer support, education, and advocacy. I am Andrea Baer, the Executive Director here at Mended Hearts. And joining me today is Brandy Terafay, who is a licensed clinical social worker in North and South Carolina, specializing in anxiety and OCD management. She is currently working in integrated primary care and private practice and has been working as a therapist for over 10 years with experience in inpatient hospitalization, outpatient groups, and individual therapy. Brandy, thank you so very much for being here with us. I'm going to turn it over to you.
Wonderful. Thank you so much. I'm really, really excited to be here. I think this is definitely something important for everybody to know, not only patients, but obviously your support network, family members, caregivers. I will preface this by saying I get very passionate with the brain, so hopefully this isn't too overwhelming. But yeah, with that, let's go ahead and get started. Okay. All right, so some of the things that we're going to talk about today, we're going to get to know parts of the brain that are affected after stress from a cardiac event. We're not going to go too in detail about the brain. There's just a few important parts we're going to discuss. We're going to look at how the brain responds to stress, anxiety, and triggers. We're going to discuss reasons behind the physical symptoms of stress. And so this isn't your body and your brain trying to torture you. There's actually real legitimate reasons why this is happening, which usually helps people to understand what's going on. And then we're going to acquire some coping skills and brain changing techniques to learn about how to respond differently. So hopefully by the time you're done, we will all be able to learn how to do non-invasive brain surgery is how I like to describe this. All right, so there's just a few parts of the brain that we're going to discuss that are really affected when anybody is triggered. And after you experience a cardiac event, that could be a very traumatizing situation for you, for family members, for really anybody involved. So your brain is going to be triggered and it is going to respond. So the main parts are the amygdala and the cortex. So first off, in the brain picture, we have the thalamus. So what the thalamus really does is it just kind of receives the information and distributes it to either your amygdala and or your cortex. So let's say you see something, you smell something, you taste something, it's taking all that information and it's going to send it to the amygdala and your cortex. It's going to go to your amygdala first because it's a quicker path. So your amygdala is right at the base of the skull. We have two of them, and its main job is to protect you. When we talk about fight, flight, or freeze response, this is from the amygdala. It's very primitive. Those are the only responses it has: fight, flight, or freeze. So run, stay and confront, or sometimes we just freeze up and feel a bit paralyzed. Your amygdala also is responsible for holding anxiety, fear, worry, and anger. And it also releases the adrenaline when it is activated. Your amygdala, once it receives that information, it's going to get it first, also communicates to your cortex, which is at the top of your brain. So your cortex job is to take that information and analyze it. It's going to be involved with problem solving, rational thinking. It's also going to attach meaning. So when we look at things like, what does the situation mean? So if you hear an ambulance, right? So it's going to take that information and attach meaning of ambulance means that we need to get out of the way, or there's an emergency that's going on. It tries to communicate to the amygdala, but that road is blocked. So when you look at the brain, the amygdala has a bunch of roads to the cortex. It sends information, hey, we're in danger, we're in danger. Ideally, your cortex will take that information, analyze, and say, well, we're not in danger, we're okay, we can slow down. But there's little to no road from the cortex to the amygdala. So what happens is all that information that's going to your cortex stops there because it can't get the correct information down to the amygdala to tell it to relax. And that becomes really difficult. This is where that frustration. So if you've ever felt angry or anxious and someone tells you to breathe or calm down or think positive, and you just want to shake them and say, I'm trying, it's not working. It's because we can't talk the amygdala down, right? So we can't rationalize it. And once it releases adrenaline, it just has to run its course. We can't put it back in. So that's how the relationship between the cortex and amygdala. We're going to talk a little bit more about that. On this picture, we also have the hippocampus, and the hippocampus is responsible for concentration and focus and memory. We're going to talk a little bit about that in a second. All right, so your cortex, your amygdala, they experience stress, anxiety, worry in different ways. So the cortex experiences anxiety and stress a little bit more logically and rationally in a way. So for example, you're driving home from work, you see a fire truck pass into your neighborhood. Remember, your amygdala's already getting that information. It's already released adrenaline. We're having physical symptoms in response to that. So we visually see the truck, we hear the truck travel through the thalamus to the cortex. Your cortex then goes to work to construct a reality. All this information is getting, okay, let me figure out a narrative of what's going on. And so the narrative is not going to be very rational because it's getting information from your amygdala. My house is on fire, and this is going to lead to catastrophic thinking. So I'll have no place to live. I have no money. What happens to my pets? I'll be alone. This is a hopeless situation. This is bad. Since the information traveled to the amygdala already, like I had said, the amygdala's response feeds the cortex monster. So this prolongs those physical symptoms. It's a vicious cycle, which we're going to talk about. The cortex's contribution to anxiety and stress is it's going to overestimate danger. We're going to see a fire truck and we're going to assume that it has something to do with us because we already have these physical symptoms. We're going to fortune tell. We're going to probably mind read some things, jump to conclusions. All those cognitive distortions and cognitive errors, we can blame the cortex for. The amygdala's anxiety experience, the example is while driving, a large truck comes into your lane, into the lane next to you. So we see the truck come in. The visual travels through the thalamus into the amygdala, and your amygdala, remember, its job is to fight, flight, or freeze. So that is activated. I'm going to protect you. Don't worry about it. But in that, we might overreact. So we're going to turn the wheel to avoid hitting the car. Your sympathetic nervous system is also activated, which means all those physical symptoms. So we're going to increase heart rate. We're going to tense around the steering wheel. Our pupils are going to be dilated, and we might overcorrect and end up in a ditch, which then causes a negative response. And an emotional memory has then formed. So the triggers is the amygdala's responsibility. So because we ended up in a ditch and we were fearful and maybe panicky, we're now going to associate cars or the truck coming into our lane or even being next to a truck next time as like danger, right? But then we know that this information isn't always true. So the trigger that developed is whenever driving next to a large truck, the amygdala is activated, pairing the memory and eliciting a similar response. What could this look like with a cardiac episode? So if you are having those physical symptoms and you need to go to the hospital, next time you might associate those symptoms with I need to go to the hospital when that might not always be the case. Now I will say, and I say this to all my patients, if you're experiencing chest pains, go to the hospital and let the doctor tell you that it's a panic attack or anxiety attack. So I think in certain situations, better to be safe than sorry. But this also affects, like I said, your support network. My experience with heart attacks and things like strokes is I had a family member who had a stroke, and I got a text message that said, give me a call as soon as possible. And, that's how I found out that they had a stroke. And then a couple years later, family member texts me, give me a call as soon as possible. And they had a heart attack. And so now my parents know when they give me a text message that says, give me a call as soon as possible, they then followed up with, but everything is okay, because the brain was then triggered. And now every time we see that, we're associated with it. So we're going to talk a little bit more about triggers. All right, so a memory is going to be formed from this experience. So a memory is an event attached to an emotion. So in that previous example, the event went into the ditch after a truck was coming near us, and the emotion was maybe frustration, anxiety, worry, panic, stress, all of that fun stuff. The stronger the emotion, the more significant the memory. And so I like to think of maybe like a riverbed, right? So the river goes through and it might make like a little bit of a dent, but the more that the river goes through, the deeper it gets, and it's really kind of ingrained into the surface of the earth. So the more that we kind of validate this experience, so the more that we might do things like avoid or continue to think of those things, or even have stuff go on. So if we're having more physical symptoms, so we keep going to the hospital, we're really validating that memory. Your memory is stored until it's triggered or pulled. So it's going to be triggered by, it could be something innocuous. It could be something that was related to the episode. It could be something simple. So like, let's say you're wearing a blue shirt and then you started having chest pains in the situation. So a blue shirt might be something that triggers that response. Because remember, your amygdala doesn't know, it doesn't really understand that. It just thinks you're in danger. Each time a memory is accessed, it is changed or modified in some way. So whenever we recall a memory, it is in a very vulnerable state where it can be changed. If anybody has ever done any kind of dream journaling, right, one of the first things they tell you is write down as much detail as possible when you wake up, because as you go throughout the day, that dream kind of changes because it's being interfered with by things that you encounter in the environment. And the same thing kind of goes with the memory. So our initial memory is going to be different than when we recall it, maybe a month, 2 months, years, things like that. And this is very important when dealing with emotional memories, because that's where trauma comes from. We do not want to erase the memory. Well, you might actually want to erase the memory, but that's not our goal. Our goal is to change what the memory means to us. And so let's go back to that shirt, that blue shirt. And so let's say the meaning we're attaching blue shirt means that I'm having a heart attack or I have to go back to the hospital. And that's not the case. The blue shirt is not causing the danger. So we want to change our association and meaning to that trigger or memory. And this is done through association and new experiences. Fun fact, when your amygdala is activated, your hippocampus shrinks. What does all of this mean? So when we're stressed or anxious or angry, have you ever gotten really frustrated because you can't remember where you left your keys? This is because the hippocampus shrinks, and your hippocampus is responsible, like I said, for memory and concentration and focus and learning. And we can kind of blame evolution on this. So as time has gone by, our amygdala has not evolved. And so it still is operating on, hey, I need to run away from that lion that's attacking me, not so much of what did I eat for breakfast that day. So our brain is really cool in that it adjusts, right? So whatever the crisis or what's needed in that situation, other parts of the brain might like back down so that it's a little bit more effective, which is really cool. I mean, yeah, it's really, really interesting how the brain operates with that. All right, so what might this look like with an event? A cardiac event occurs. The emotions involved are fear, anxiety, and worry. The thinking that might be involved is, this is not normal. Something is wrong. I need to go to the hospital. The memory is going to the hospital, physical symptoms of events, plus the fear. So I'm having difficulty breathing. I'm wearing that blue shirt. I hope that no one was wearing a blue shirt. If it did, I'm sorry if I'm ruining this for you, but I'm wearing the blue shirt. That means that this is happening. And we know that logically that's not the case. Rationally, it's not the case. But when we're anxious and we're in that crisis situation, none of us really think rational, or we'll try, but remember that message doesn't get down to counteract the fear. Later on, your chest starts to feel tight. Let's say you're watching a movie and your chest starts to feel tight and your brain says, this is something I've experienced before. I must be having a heart attack. It's going to try to protect you. So then we do the fight, flight, or freeze, which releases adrenaline. It increases physical symptoms. And then we strengthen the memory association the more that we do that. So we can get ahead of this, which is exactly what we're going to talk about a little bit later, of how to change the association and how to prevent a possible anxiety or panic attack that might come from being triggered, and then change the association of what those triggers mean to us. All right, the stress cycle. So I know no one has probably really dealt with stress, so this might be new to everybody, especially from a pandemic. But this is kind of the cycle, the vicious cycle that continues to happen. So there is a trigger, and what that's going to do, remember, activates the release of adrenaline, and it's going to activate it's going to activate the amygdala, which then causes the release of adrenaline. That is going to start the physical symptoms. And there's a very specific reason why we have those physical symptoms that we'll discuss. So let's say you have racing heart, difficulty breathing. So the natural thought is, I'm having a heart attack, or something's wrong. We're unable to communicate to stop the adrenaline. So this information is being sent to your cortex. Remember, it can't correct the amygdala. So, and it's not going to stop the adrenaline once it's released, it just has to run its course. There's nothing we can do to put it back in. What's that going to do? It's probably going to increase those physical symptoms. So you might have additional ones. So you might start to feel tense, you might start to get a headache. And what that's going to do, continue the cycle, because your brain thinks you're in danger. Your brain is so special and miraculous. It will try to protect you. It tries to play you sometimes too with some incorrect information, but this is really what it's trying to do. It's just misinformed. All right, so all these physical symptoms, why are we having them? This has been really helpful for a lot of my patients. If they know a reason why, it's usually easier for them to cope with it and also correct it if it's acting a little inappropriate. So we have the racing heart, right? Your body's trying to keep up. Your heart racing is reminding you that it is working. You know, when we're running, exercising, anything with the release of adrenaline, your body's going to respond to that. Heart racing, heart increasing is good. It's the heart stopping that we don't like. Then we have problems, right? Remember, cardiac arrest, it's going to stop. Now, again, there's limitations with this. I think it's very helpful to at least know your baseline heart rate, your resting heart rate. you can do this if you have a tracker. You could take your pulse. I think that was the worst thing I could have done to teach my husband, is take his pulse, because he keeps doing it now and does it incorrectly. But taking your pulse, I think, is helpful, just to have something to compare it to know, is my heart actually racing? Is it within normal limits? Talk to your medical provider also to see, like, hey, when my heart rate reaches this number, is that when I need to be concerned? But heart racing is your heart reminding you that it's there and it's working. It's good. Sweating, we will sweat to cool down your body. You're too hot, you're overheating. So your body is going to react. Okay, let me sweat. Let me cool it down a little bit. Dry mouth or cotton mouth, your digestive system automatically slows down when the release of adrenaline occurs. And this will then allow for more immediate needs to take over. So some people, when they get anxious or stressed, they use the bathroom very frequently. Some people will have that cotton mouth, so everything just slows down. You can't really worry about swallowing, again, when you're running away from that tiger. We'll get tunnel vision. So this is one of the most interesting things, I think. When the release of adrenaline occurs, our pupils automatically dilate. And that's to give us an opportunity to be hyper-focused on and concentrate on what's right in front of us. Which is probably one of the worst things that you can do when you're stressed or anxious or angry, is go for a drive, because that means our peripheral vision is not working appropriately. So I also really enjoy these, the pupils dilate, because that means that we can reframe this physical symptom. So there's a lot of really good things that we could do that require us to have hyperfocus and tunnel vision. Studying, doing any kind of artwork, doing our taxes, all of that stuff, we need to kind of block out some of those things. But that's the reason why we might get that tunnel vision. Your muscles will tense up, and this is your body's way of preparing to fight, right? When the release of adrenaline occurs, it's not so bad. It's not great when there's no real danger, but the release of adrenaline allows us to run faster and jump higher, punch harder. You know, it really is preparing us to protect ourselves. And that's usually where the muscle tension occurs. With the muscle tension also, I'll have some people that say they'll get a headache right at the base of their skull, and that's sometimes because we're like holding our shoulders up here like this. One of my favorite things is when a patient comes in for the first time and they're like this, and they complain of a headache, and then when the session's over and I was like, how you feeling? They said better. I was like, yeah, because your shoulders are down, and we're not so tense. Difficulty breathing. So this usually is because we need to take in rapid breaths. Again, like if we're running, you're not like doing a bunch of like deep breathing when we're running. This causes probably the most trouble for people besides the racing heart, because it could mimic chest pain and chest tension. So when we're breathing from our chest, which is usually what we're doing when we're panicky or anxious or stressed, you're putting a lot of pressure on your chest. And it's really interesting. So I'll have people who will say, I have a lot of chest pressure, my chest feels tight. And I'll ask them, where are you breathing from? And they say my chest. And I say, okay, let's switch to our stomach and see how that goes. And usually within seconds or minutes, like that pressure is relieved from their chest. Also, when we breathe from our chest, we're not getting that full breath in. We're also likely to be hyperventilating because we're taking those rapid breaths, we're breathing from our mouth, and hyperventilating will cause lightheadedness, which is another physical symptom people complain about. Numbness and tingling, this is usually due to lack of blood flow because we're clenching our fists and we're like all like tight and tense and clenching our toes and you know, releasing that tension within a few minutes. If that is what's going on, it'll usually be relieved. But if you can look, racing heart, sweating, dry mouth, tunnel vision, tension, difficulty breathing, numbness and tingling, if you're having all of those things, or even some of those things, it is very easy to think like, oh my goodness, this is happening again. And then that creates the cycle. So what can we do to relax ourselves? So my first favorite coping skill is the mammalian diving reflex. So if you've ever studied deep sea divers, one of the things that they do to train to be able to normalize their vitals underwater is they'll take their face and dunk it in an ice bath. And what that does, it hits onto pressure points right here on the side of your nose and at the top of the bridge of your nose. When something cold hits that, it puts us into a slight bradycardia, which means it slows down our heart rate. If your heart's racing, we would want it to slow down a little bit. And so we can mimic that same thing by taking something really cold, an ice cube, an ice pack. Sometimes I'll have people carry like a frozen bottle of water with them and very firmly press it on the side of your nose, on your cheekbones, and then at the top of the bridge of your nose. And within seconds, your heart rate starts to slow. This is everyone's favorite because you don't have to think about it. And usually there's an ice cube or ice pack around. I've even had patients who might feel a little anxious in the grocery store. I'll tell them to go to the frozen food section, get a bag of peas and put it on their face, or at least at those pressure points. Yes, you might look a little bit silly, but I mean, who cares? We want you to feel comfortable and, you know, they'll go on with their groceries. It doesn't matter. We just want you to feel less stressed and anxious. The 4-4-4 breathing is another skill that's really helpful because it's based in science. So again, breathing from our chest is what's creating that chest pressure. Breathing from our stomach is what we want to strive for. So usually the tool with this is we breathe in through our nose for 4 seconds. We'll hold it for 4 seconds, and then we'll release for a count of 4. And we'll do that three times. What's really important about this is it puts pressure on our vagal nerve, and our vagal nerve runs up our spine. And when there's pressure applied to it, it slowly starts to deactivate your amygdala, that fight, flight, or freeze response. So it's not saying danger, danger, danger. Maybe it's saying caution, caution, caution. It also introduces more serotonin into the system, which is that feel-good chemical. And it decreases the amount of lactate in the blood, which is what creates that antsiness, wanting to jump out of your skin, anxiety feeling. And that's all from breathing from your stomach. And that's something that we could try really quickly if you guys would like, just one round. And so we'll breathe in through our nose for 4 seconds, hold it for 4, and then release for 4, and I'll count. If you don't know where your diaphragm is, I always tell people, take your thumb, put it on your sternum or where your rib cage meets, and put your palm directly below. And that's your diaphragm. If we're breathing like this, that's not your diaphragm. We want to push that stomach out. So just take a second and go ahead and breathe in, hold, and breathe out. Good. And if you have your back on the back of a chair, pressing up against a chair, usually you can feel that pressure on your spine. But I love doing that as part of relaxation when you're going to bed. Maybe if you're having some racing thoughts, if you're out and about, because no one's really going to know what you're doing. We breathe all the time. I love people using this for road rage, right? So you can use that anywhere, anytime. Grounding skills. Grounding skills are a great coping skill for the same reason. You can use them anywhere, anytime. No one really knows what you're doing. And so some of my favorite, the 5-4-3-2-1, I think is the most used one. There's different variations of it, but it's naming 5 things that you could see, 4 things that you could touch and touch them, 3 things that you could hear, 2 things that you could smell or taste, and then 1 deep breath. Like I said, there's different variations around those, but that's the 5-4-3-2-1. And the whole point with grounding skills, by the way, is it puts you in the here and now. So if you're having some triggers, that means your brain is in the past or in the future. It's definitely probably not in the moment. And so this really redirects your thoughts and gives yourself a little bit of a break. It gives you something not important, but intentional to focus your attention on. These skills are not going to resolve everything. It's, again, just going to give you a break so that you can kind of get to a safe place physically and mentally, and then we can kind of look at changing thoughts. The categories game is something that's helpful. So coming up with 10 different types of pie, 10 sports teams. I have folks that will come up with an animal for every letter of the alphabet. Again, something we're going to have to concentrate on, which means we're not in our head, and we're not thinking about some of the things that's creating worry for us. A grounding object. So this is something else that's been helpful for people. So it could be a piece of jewelry. It could be a coin, anything with texture that you can rub your finger on. I know they have the worry stones, and I think they have some that heat up. That's been really helpful for people. The next one's describe an everyday activity, but we would do this in great detail. I had a patient who, this would be a family activity. So when the kids and the husband and everything were just kind of a little rambunctious and they needed to like slow down, they would take turns doing this. And that's where that peanut butter and jelly sandwich comes from. So we would, in excruciating detail, talk through the steps of making a peanut butter and jelly sandwich. So it would be, I would walk to the cabinet, left, right, left, right. My right hand, I would open the cabinet. With my left hand, I would grab the jar and just break it down like that. And then progressive muscle relaxation is another skill, especially if you're one that has a lot of that tension. So you would just start at your toes, squeeze your toes for 5 seconds, release, then your toes and ankle, release, and then toes, ankle, calf, and you just go all the way up your body until everything's kind of clenched, and then release. People really enjoy doing this before bedtime. It kind of lets them feel like they're like sinking into a little bit of relaxation before bed. The next ones are compassion statements. And so whenever we kind of go through some kind of traumatic situation, well, not even just with traumatic situations, I think in general, we can be really, really harsh on ourselves. We would never speak to ourselves, hopefully, like we would a small child or even a best friend or a family member. And so bringing compassion statements towards us really does great things for our brain. And again, this one's based in science. So by placing your hand on your chest or your heart, that releases a chemical called oxytocin. And oxytocin is the love chemical or the bonding chemical. So just by doing this, we're releasing chemicals that make us feel attached, which is nice. And so for extra credit, we would include a compassion statement. And if you're feeling triggered in that moment or stressed out, even identifying that, like, this is really difficult. This is a frustrating situation. I'm sorry that you're going through this right now. Those statements are really, really helpful. Something my OCD people really enjoy, the I'm sorry that you're having a bad OCD day or moments. It really just allows you to be kinder to yourself and not so critical. That critical is really just going to play into that stress and anxiety mind. So this is going to counteract that a little bit. And then a safety card. So remember, when your hippocampus shrinks, we can't remember things. So these are all great, but when we're in that panicky crisis situation, it's going to be difficult for us to recall that stuff. So a safety card is something that people like to do and have in their wallet, in their pocket, have their support person have it. And really, it's just a list of 5 coping skills that you can utilize. One of the things that we'll do is have somebody or have you put someone's name and their phone number to call. Well, I guess with smartphones, you don't need the phone number, but their name. If it's a song that you want to listen to, we would put the name of that song. So we would want to decrease the amount of barriers on that safety card, make them very simple. It might say 10 different types of pie. It might say, call mom or call dad. It might say, go outside and walk for 10 minutes. So it's just a nice reminder also. Okay. All right, so we're going to change the brain now. So this is that non-invasive brain surgery that I really like to say that we're doing. So your amygdala learns only by being activated. So just like we don't learn when we're sleeping, neither does that part of your brain. What this means is we will probably be uncomfortable or feeling some strong emotion like fear or anxiety. But I want us to think of that as your brain saying, I'm ready to learn, like teach me, like I'm here, I'm ready. So at that point, let's use that blue shirt example. So let's say, that seeing that blue shirt, that makes us really uncomfortable and anxious. That's your brain saying, teach me something new, I'm ready for you. And so what we'll usually do probably is put that shirt back. We're not going to wear it. We're not going to deal with it. What we would like to do then is learn how to respond differently. That was a nice shirt that we had. It was our favorite shirt. We want to be able to wear it again. And so pushing through and tolerating that discomfort, maybe putting that shirt on, maybe watching a show with somebody with a blue shirt, doing small things that kind of reincorporate some of those triggers allows you to teach your brain like, hey, the blue shirt did not cause the cardiac event. The blue shirt is not dangerous. Yes, this is uncomfortable, but I'm pushing through it. And then the next time you do it, it's gonna decrease even more that anxiety to the point where you're gonna have to be asked to wash the blue shirt because you're wearing it so often. What's really cool about the brain also is it's very use or lose. So because we're not avoiding things anymore, it doesn't need that skill. So it tosses it. And then we have this new way of responding to those triggers. Another example is the hospital, right? So like if the smell of the hospital is triggering for you, maybe watching shows that incorporate hospitals or medical care, maybe smelling a Band-Aid because Band-Aids kind of had that smell. Maybe just going outside the hospital, just very gradually kind of getting through all of those associations. We're recreating meaning. So our goal is to push through that discomfort, right? If we avoid, we're validating that anxiety and we want to change how we respond to the anxiety. As soon as you push through, by the way, so let's say 0 to 10, your anxiety is a 10 when you see that blue shirt. As soon as that anxiety drops 50%, your brain just made a new neurological connection. You just taught your brain something new, which is so incredible. Like you did that. It's really, really fascinating. Avoidance is the enemy. Like I said, avoidance really just validates that anxiety. What we're doing also is recreating that meaning, right? So that blue shirt right now is danger. Whereas if we push through and we teach our brain a different way of responding, that blue shirt, it's not going to mean, oh, every time I wear that blue shirt, I'm going to have to go to the hospital. The new memory is maybe I wore that blue shirt when I went to the hospital and I'm going to continue to watch this movie or do what I was doing. We're changing the narrative. We're changing our experience of things. And that's really what memory is. It's your experience with that emotion. If you ask someone else, your support person, they're going to have a different memory of what happened because they're going to have a different experience. So this is really amazing, guys. Like your brain is fascinating. I always say this, and I apologize to my podiatrist out there, but the foot is the foot. So it hasn't really changed much. We probably have learned everything we're going to learn about the foot. The brain, though, the brain changes all the time and we change it all the time. It's just so empowering to know we have little control, but we also have a lot of control over the brain. And we will probably never know everything there is about the brain because it just changes so much. So this is my pedestal that I was talking about of the passion for the brain. But yes, you can change your brain. It is not stuck. It does take some work. Like I said, it is uncomfortable, but man, the rewards from it, it's pretty amazing. The other thing that's interesting when you start to do some exposure techniques to challenge some of those triggers are your senses change. So you see things, literally see things differently. And your sense of smell will change as well. I have done a exposure therapy with a patient who had a fear of vomiting, and we would crush up cookies and toss water in it so it kind of looked like vomit. And as her anxiety was high, she would smell vomit, but as the anxiety dropped, it would smell like chocolate chip cookies. And so our brain really influences all of our senses as well. Which makes you question the memory. Like I said, memory isn't super reliable, but the influence our brain has on our senses and our perception is pretty amazing. All right, so some resources. We are in a technology age, so there are some apps. There is the Calm app that a lot of people really enjoy. They also have Headspace, which is my favorite. I am not endorsed by them, but if anyone works for Headspace, I will happily take that endorsement. The reason I like Headspace is because I deal with a lot of anxious and stressed people. So if you have racing thoughts, there's always something on your mind, you will need some guided meditation. You need something to listen to. Headspace has that. So they have 3 to 5 minutes guided meditations, and it's also really specific meditation. So if they have some for if you're stressed at work, they have some for if you're feeling overwhelmed or angry or agitated. They have great ones for sleep that I've used several times. So and I think they have a deal with Netflix too. So if anyone has Netflix, you can use that as well. The Netflix one, I believe, is included in Netflix. The app is free. And then I think you could do like in-app purchases. Support groups, obviously Mended Hearts is so fantastic. I was saying before we started, I've done some work and some talks with Mended Hearts. It's just amazing. You guys being able to have this network of supports, but also like caregivers and support people, those with cardiac events. Like it's just an amazing thing. Everywhere I go, I used to work in Charleston, now I'm in Charlotte. Everywhere I go, whenever I see a patient with any cardiac issues, I always drop Mended Hearts as a resource. So I'm super appreciative of everything everybody does. NAMI, National Alliance for Mental Illness, also have chapters everywhere. They used to run it where when you would go to the supports, they'd have one set for those with mental health issues, and then they'd break off with their support. I'm not quite sure if they do that now, but it is for people with mental health issues as well as their support people. Social media groups are also out there. I think one of the great things with them is it could be anonymous and it's easy access, right? So like, let's say like you're feeling really stressed and lonely or upset or anxious, like you can just like whip out your phone or computer and just like go on and search for a group. So I will say, be careful with the social media support groups. Do not get into a rabbit hole of doing a bunch of research. Really just utilize it for like the support aspect. Triage nurses is something I don't think is utilized that often. So on the back of your insurance card, most insurances will have the number for a triage nurse. And so if you are at home, you're like, listen, I've done all these techniques that Brady's telling me to do. I still feel like something's wrong. Give that triage nurse a call and say what your symptoms are. They might say, okay, we need you to go to the hospital. They might give you more resources. They might give you a peace of mind. I think that triage nurses really need to be used more. Along with triage nurse, and I didn't write it down, is the 211 number. So 211 is a United Way organization. They have great resources in the area. Usually you just tell them where you're at and they'll tell you the resources there. But the other part of 211 is the crisis hotline. It is not so much a suicide hotline. The crisis hotline is anonymous. They can legally not hang up on you. So if you are up at 2 in the morning and you just need someone to talk to, you can call up 211 and they'll talk to you. You don't have to give your name. You don't have to do anything. It's just someone there to talk to. Especially when you feel like there's no one there, or you don't want, I think a lot of times when we reach out for help, or what prevents us from reaching out for help is just feeling like a burden. Like we don't want to bother anybody. I'm saying there's people out there that you're not a burden, first of all, but there's people out there that do want to help, but they're not mind readers. You have to take the first step. The Feeling Good Handbook is a book that I've been using for over 12 years of practicing. So when we're in our head and in those irrational thoughts, this is a great resource to work to challenge those thoughts, right? So it's those errors in our thinking that make us isolate, that make us maybe a little bit moody or upset or anxious. So changing those errors in our thinking will then improve our mood. And that's where the Feeling Good Handbook comes from. And then smart trackers. Like I had said before, if your heart's racing, take your pulse. But that's what smart trackers can do also. So the Apple Watch, the Fitbit, any steppers are really helpful with that. It gives you your baseline. I know that I just upgraded my Fitbit and they have this new one where it'll alert you if your heart is in an abnormal range or your oxygen level is not where it should be. Don't get obsessed with it, but it's just a good resource to have as well. If you're a person who had a cardiac event at nighttime and have night terrors, or even someone who you maybe got that call about your family member having an episode at nighttime and you're having night terrors, there's trackers within those that help prevent those night terrors. I know Apple Watch will have NightWear built into it, I think, and I think the Fitbit has just come up with one too, but essentially what it is it monitors your sleep cycle, and when you start to get into that REM, that dreaming phase, it'll give you a slight vibration on your wrist, and it's not enough to like wake you up out of bed, but it's just a little vibration of okay, I'm here. And then you're not going to dream. So you're going to get rest, but you're not going to dream. And that's just a really remarkable technology that was started from the son of a man who was having night terrors after deployment or some trauma. He developed this, and it's just a really, really cool and interesting technology, like I had said. So with that being said, I am very eager to see any questions or comments or corrections even. I love the brain. I do not know everything about it, but I really appreciate everything that you guys do. And the fact that you guys have this really great support is pretty fantastic. Mental health is obviously something that I think is easily stigmatized, and the fact that you guys are joining us for this and wanting to know more about it, like you're breaking that stigma. So I definitely appreciate you.
Absolutely, and I completely agree. I just want to give everybody a moment to type into the Q&A box if you have any questions. Thank you so much for sharing all of this. I didn't realize that every time you recall a memory, it changes just a little bit. So that's interesting. Because I'm a mom of a child with a congenital heart defect. And there are definitely long-standing memories that I can tell have changed and evolved over time when we look back on it. So I am happy to take any questions from the audience. The first question that is up says, where do you touch to release oxytocin?
Oh, yes, absolutely. So your hand to your heart or to your chest.
And that releases oxytocin.
That releases oxytocin. If you hold hands with a partner, or even like give your children a hug or anything like that, that also releases oxytocin. Sometimes we don't have everybody around us. So this is just something that you can do on your own.
Excellent. The next question is, does the hippocampus return to size after an event?
Yes. Well, okay, yes. There are certain parts of the brain that could be damaged, like from things like stroke, but the brain is really resilient. And so other parts of the brain will either learn to overcompensate and help out with that area that's a little bit damaged. The hippocampus will definitely return back to normal size after the amygdala is deactivated as well. So it's not a permanent thing. It could definitely be affected long-term.
Great, great. I will make sure to let everybody know you can still type questions into the Q&A box. We do have the chat box there as well. Jody or Leslie, one of you, if there's anything in the chat box I need to know about, can you let me know? But this question, oh, this is a great one. Can a nightmare cause a heart attack?
Oh, that is a very good question. So I'm not 1000% sure. I know that a nightmare can create the sense of a heart attack, and that's really what a night terror is. And so we have these mechanisms when we're sleeping that monitor the environment to keep us safe, right? So like if anyone snores, you're going to wake up because you stop breathing, which is a good thing. When we're having a night terror, your brain feels like there's danger that's happening, and that's why it's waking you up. So we're still going to have the sympathetic nervous system activated. I would say it's not out of the realm of possibility. I have not heard that happening. So I would definitely ask your doctor, actually. I think that would be interesting.
Yeah, I think that sometimes a lot of stress can cause that feeling, just overall and during the day or even at night. But it's interesting that a lot of times women, especially, I'm sure men too, heart attacks are overlooked or heart problems are overlooked because they say it might be anxiety or it's just, you know. So I think that the symptoms are a lot the same. So that's interesting. All right.
Andrea, there are just one comment about someone thanked us and needed this presentation so much, but there are a couple about the slides as well, if they will be available in the chat box.
Absolutely. So I will go back over that. The PDF version of the slides as well as the recording will be available probably tomorrow. And they will be on our website and on the YouTube channel along with the handouts. And so with that, I will remind everybody that we will be back here next week on May 12th, talking about after a diagnosis and how to build your support network and why that's so important. That will be the second webinar in our series. And we will be joined by Jessica Daly for that one, which is super exciting as well. If there are any other questions, last call. I just wanted to thank you again, Brandy, for being here with us and for taking this time to share such wonderful information with us.
Yeah, pleasure's all mine. Thank you so much. I appreciate it.
Thank you. Everybody have a great day, and I hope to see you back next week.